All right, so medications that increase your risk for blood clots, part 2. Selective estrogen receptor modulators, or SERMs. These are medications that act on certain estrogen receptors, like agonists, and also block certain estrogen receptors, act as antagonists. So 2 examples are tamoxifen and raloxifene. These are 2 medications that are used in pre- and postmenopausal women to decrease the incidence of breast cancer in those who are of high risk. This is called chemoprophylaxis. Tamoxifen is an agonist at bone and the endometrium and an antagonist at breast tissue. Raloxifene is an agonist at bone, and then it's an antagonist at breast and endometrial tissue. So tamoxifen increases the risk for uterine cancer. Raloxifene also is used second-line therapy for osteoporosis after bisphosphonates like Lengenate or Fosamax. Tamoxifen is also used as adjuvant endocrine therapy in estrogen receptor-positive breast cancers. A third-generation SERM, or selective estrogen receptor modulator, is bazidoxifene. It's in the combo product YOUR.FAV with conjugated estrogens. It's used for the vasomotor symptoms of menopause, being like hot flashes and night sweats, and then it's also used for osteoporosis, specifically for prevention of osteoporosis in postmenopausal patients with a uterus. So raloxifene is for the prevention and the treatment of osteoporosis. Another SERM is ospemophene or Osphena. This is used for vaginal dryness and dyspareunia with menopause. So dyspareunia is pain with intercourse. Some of the medications that can increase the risk for blood clots are anti-VEGF monoclonal antibodies. So VEGF is vascular endothelial growth factor. This is a signal protein that cells release to stimulate blood vessel development. So we use these medications in something like solid tumors, like cancers, because tumors cannot grow past a certain size without adequate blood supply. One example of a VEGF monoclonal antibody is bevacizumab or Avastin. It's used for metastatic colon cancer or stage 4 colon cancer in combination with fluorouracil chemotherapy. For example, FOLFOX. So FOL is folinic acid or leucovorin. It's used as a rescue agent with methotrexate, but in this case, it potentiates the activity of fluorouracil. Ox means oxaliplatin. It's a platinum agent, so it inhibits DNA synthesis. It's moderately emetogenic too, so it causes a lot of nausea, vomiting. Fulfuri is another option. The ERA stands for irinotecan, which is a topoisomerase 1 inhibitor. It can cause a lot of diarrhea as well. I'll also mention that bevacizumab is usually used for like right-sided tumors with colon cancer. I'll also mention that bevacizumab is also used in the treatment of stage 4 non-small cell lung cancer. And then another drug, ramucirumab, is also used sometimes with the disease. It's a VEGF2 receptor blocker. It's also a monoclonal antibody. And then the last medication I'll mention is like androgens, like testosterone. So some studies are showing like there's no risk, and then some studies are showing there is a risk. So testosterone is known to increase hematocrit, and then there is a thromboembolic risk there. So either this is at therapeutic levels or super therapeutic levels. It's still going to be on my list. So super therapeutic means like above therapeutic level, so in excess.